Diabetes is a silent global pandemic, and India today is also affected by diabetes, and we have a large population which has diabetes. Diabetes is not restricted only to the elderly or the morbidly obese, but even youngsters. Now, diabetes has got target organ involvement. Now, the target organs commonly involved are the eyes, the heart, the nerves, as well as the kidney. Now, for the kidney, there are peculiarities. And these peculiarities are that increasing blood sugars can actually harden the renal arteries and thereby actually reducing the blood flow in the kidney. Now, there are lots of poisonous substances or wastes which are manufactured by the body, and these have to be thrown out. Now, if the blood flow to the kidneys is reduced, then automatically these waste products start accumulating in the body, and they have a number of deleterious effects to health. High blood sugar also can damage the glomerulus, which is the distilling factory of the human body. Now, imagine that even if the blood flow is completely normal, but there is no capacity to distill, then what are you going to do? You start accumulating those wastes like urea, creatinine in your system, and that starts to progress, and then you go from one stage to another and land up with chronic kidney disease. Now, with this chronic kidney disease, you will just have to undergo dialysis at some particular point of time, or you will have to face transplant, the reality of transplant at a particular point in time. So therefore, to control the diabetes is so much easier. Why go in for a disease which can be controlled and very well controlled? There are newer medications, there are newer methodologies of treatment, there are newer drugs and molecules which have come, as well as there are the focus on lifestyle changes. And with lifestyle changes and with these medications, one can actually start controlling diabetes. Should you be able to control diabetes, the impact on the target organs is enormously reduced. So, therefore, a lot of people are going to be suffering from kidney disorders related to diabetes, and this is only because blood sugar can actually damage the framework of the kidney, which actually helps in distilling as well as purifying your system. Therefore, it's always good to consult your endocrinologist or your diabetologist who's treating you on a very regular basis. And if there is any detection of a kidney disorder by rising levels of urea creatinine, it is always good to consult a nephrologist. In the early stages, all these can be controlled, but in the later stages, there is dialysis, and post-dialysis also there is kidney transplant. So therefore, diabetes must be controlled by all those who are preyed to this disease. And if you are able to do that, then I doubt if you will have long-standing kidney damage.